Okay, hi everybody. Do you all have a great weekend? Thanks so much for tuning in and joining me on this lovely Monday evening. I hope you all did have a great weekend. Feel free to throw it in the chat if you feel like sharing. Um, so, today we are going to be talking about a subject that I know is really uncomfortable for a lot of people, and I don't want it to be scary. Conversations about sexually transmitted infections are often pretty scary for people. Most often because historically, sex ed programs have used them as scare tactics, and it's been a way to try and scare people into not having sex by being like, oh, look at all these horrible consequences, never have sex ever, oh my god. Um, I don't want it to be that way. The conversation about sexually transmitted infections does not have to be terrifying. It doesn't have to be heavy with all this intense emotion. We can just talk plainly about it. The bottom line is that this is important stuff to know, and we want to know it so we can do what we can to protect ourselves. Now, this week I decided to do something a little bit different, and so this week we're actually going to do a theme. And the theme this week is going to be sexual health. So we're going to talk not everything about sexual health because there's no way we're going to fit all of that in 1 week or 5 days. But for the next 5 days, we are going to talk about some topics that are pretty important to sexual health. Now, I like to, as always, encourage comments and questions and people to call in with their thoughts or stories or experiences if they want to share. Obviously, no pressure, but if you have any concerns, please call in or question or share. On Friday, along with Friday's topic, we are going to have more of a question and answer period. So if you're watching this or listening to this after it's already been live and you have questions, please tune in for Friday's show because that'll be the chance to catch up all of your questions from the week. So yeah, so let's move forward with our sexual health week and our first topic being sexually transmitted infections. So, girls, who am I? I am your lovely host, Tila. I'm a sex educator, relationship expert, and published author. I've been doing sex ed for a number of years. I love it. It is my passion. I want everyone to be able to have as much fun and be relaxed talking about sex as I am. So that's sort of my mission in life. I want to help people connect with their pleasure, and most of the time I'm pretty decent at it. So, that's good. So moving on. So just as a reminder, especially during this week when we're talking about some issues that can be a little bit more sensitive, if you want to comment, and please, I encourage you to comment and engage. I love it when people chime in with their thoughts and ideas. Just remember to try and keep those comments helpful. This, like I said, this can be a very sensitive topic for people. We don't need to shame people. There's nothing shameful about sexually transmitted infections. Unfortunately, a lot of people feel it is inherently shameful. We're going to talk a little bit about that this week, but it's not. It's just a state of being. People do not get ashamed when they get a cold or when they get a fever or when they get cancer. People are not, well, cancer has a lot of things to it, so let's not go there. But the point is, it's a disease. It's an infection like anything else. There shouldn't be all this shame around it. So let's try and keep the comments positive and supportive, okay? Okay, so we're going to open up the phones. Of course, if you want to call in with your comments or your questions or your stories, please do. The number, of course, is 1-877-777-5589. And I do encourage everybody to call in as much as possible, and I will try to talk slower. I realized last week I talk very fast. I'm a fast talker. So it does make it more challenging for people to call in with a thought on something that I've said because I've already passed it. So we're going to try and slow it down a little bit. So please do call in and participate. In the meantime, the first sexually transmitted infection, I guess not infection, but more of a pest that I'd like to discuss is pubic lice. So I have these plushies, which I love. Most of them are actually pretty adorable. I do not work for Giant Microbes, let me just say, but I love their plushies. Giant Microbes is a company that makes plushies for doctors and nurses, and you can buy them, the general public can buy them, but it's sort of to help things seem a little less scary and make it a little bit easier to talk about. And that's why I love them. I actually take these to all my sex ed talks that I'm not doing in person right now, but when I go do in-person talks, I take these to all my sex ed talks because they're adorable and fun. And you can buy them all sorts of places or through the website Giant Microbes, so if anybody's curious about that. So, pubic lice, commonly known as crabs. They get that name because they look like a tiny little crab. Pretty straightforward. But they're actually a breed of lice. And what they do is they have these little pincher guys, and they cling onto the hair, and then they use these little pincher guys and they suck our blood. It's not very pleasant, but that's the reality of it. Often a major symptom is itching. People who have had pubic lice for a while or have very sensitive skin, sometimes what can happen is that if a pubic lice is feeding from the same area repeatedly, then you might get like a little blue spot or something like that as well. And of course, scratching can cause some irritation and potentially some other infections. So yeah, that's sort of pubic lice. So they're mostly obtained or passed through sexual contact. They, of course, can be passed by shared linens or clothing, things like bed sheets, towels. Hopefully people are not sharing underwear. But that's usually how they get around. I know a lot of people will say that they don't worry as much about pubic lice because they shave or wax in their genital area, and that does work. However, it is important to note that pubic lice will actually grab onto any hair that is coarse. So that could be, things like legs or armpits or chest hair or, gentlemen with facial hair, so beards and mustaches, they will hunker down there as well. So it's not just genital hair, but it's any kind of coarse hair that they can hang on to, they will. So that's important to know. A lot of over-the-counter lice treatments will actually kill pubic lice. However, if you've tried that and it's not working, then just an appointment with your doctor to get something a little stronger. So yeah, that's the cute little pubic lice that aren't really that cute in reality. I wish all of the STIs were as cute as their plushies, but sad state that they're not. Anyway, if anybody has thoughts or comments about pubic lice, or maybe you know something about pubic lice that I didn't mention and you want to share, please feel free to comment or call in. And we'll put our little pubic lice friend to the side. So this friendly little plushie represents chlamydia. In case anyone's wondering, the reason the plushies look the way they do is this is what the virus looks like under a microscope. I'm not sure entirely actually about the color scheme. I think they do try and match the colors somewhat, but the general shape and the little look, minus the eyes, of course. I have had people ask me about the eyes, and no eyes on the viruses, but that's just to make them a little bit more cute. Anyway, so here we have chlamydia, and the symptoms of chlamydia are fairly normal for a bunch of STIs, and when we talk a little bit more, you'll understand what I mean. But typically, symptoms include an abnormal discharge and a burning sensation during urination or peeing. And for people who have vulvas, it can be painful during intercourse. And for people who have penises, there may be some burning or itching around the opening of the penis. And some people, not everyone, but some people may experience some pain or swelling in one or both of their testicles. So there's a lot of things that you should know about chlamydia. One of the major things is that only 80% of people experience symptoms. only 20% of people experience this symptoms. 80% of people are asymptomatic, meaning they experience no symptoms. So that's important to know because a lot of people can be carriers and pass it through sexual contact, but not actually be showing any symptoms, and they wouldn't even know they had it unless they got tested. The other thing to know too is that chlamydia doesn't just infect the genitals. It can actually also infect the eyes and the anus, and as well as the throat. Chlamydia is actually a major cause of throat cancer, and that's usually due to unprotected oral sex. So, long-term effects of chlamydia. Overall, chlamydia itself will not kill you. However, it can leave you open to other infections that can put lives at risk. The biggest risk being pelvic inflammatory disease for people who have vulvas. That's quite an unpleasant thing and can cause severe bleeding and eventually death if left untreated. The other thing too is that an untreated chlamydia infection can cause infertility. What happens is that for both reproductive organs, repeated or extended bouts of chlamydia can actually build up scar tissue in various parts of the reproductive organ. For women, it's usually along the fallopian tubes, and for men, it's along the seminal tract. And that scar tissue can actually interfere with the ability to have children. So that's pretty important to know for anybody. Well, I mean, it's pretty important to know whether or not you plan to have children, but it's definitely important to know. The good news is that chlamydia can actually be treated with antibiotics. So there's a couple different types of antibiotics. Typically, it's a one-time dose or a once-a-day pill for 7 days. And which one you get prescribed will sort of depend on your personal history as well as the severity of the infection. So that's sort of something you need to discuss with a health professional. Regardless, if you get the one-time dose, you shouldn't have any sexual contact with anyone for up to until 7 days have passed. Same thing with the 7-day dose. You shouldn't have any sexual contact with someone while being treated for chlamydia, because chlamydia is a bit of a jerk. And just say you have a couple and one person finds out that they have chlamydia, and they go to the doctor, they get diagnosed, they get their antibiotics, and then they start taking them. So now person A is taking chlamydia, and they come home, and there's their partner, person B, and if they have sex, despite the fact that person A is on antibiotics, they can actually still pass it to person B. So now person B has it, and person A is sort of getting, they're getting their treatment done, and so now they don't have chlamydia anymore, but person B does. And so person B now, whether they experience symptoms or maybe just get tested, they find out they have it, they start their antibiotics. Same thing, if they have sex during that time, they can just pass it back and forth. And couples have been known to accidentally and unknowingly pass chlamydia back and forth and back and forth and back and forth. And that's just, it's not good for us, right? So it's really important when treating a chlamydia infection to make sure that you're following the doctor's orders. Take the antibiotics, take all of them, finish them, even if you're feeling better, and make sure that you don't have any unprotected sexual contact during that time. There was something else I wanted to say about chlamydia. While I'm thinking, does anybody think of anything I might have forgotten? Now's your chance to showcase your sexual health knowledge. Pretty awesome. I love it when people tell me stuff that I've forgotten or don't know, because it means that they've been paying attention, and I love that. So, no, I think maybe that was it for chlamydia. It's kind of cute. All right. No questions or comments yet, eh? I know, this is everybody's favorite topic. You should see people's faces when I go in to teach classes on this one. But like I said, super important stuff to know, and knowing it could save your life, right? So it doesn't have to be horrible and scary. It can be kind of fun. The plushies make it fun. I like it. I like the plushies. So this is gonorrhea. Gonorrhea. Oh, I just remembered what I wanted to say about chlamydia. Thank you, gonorrhea. You totally reminded me. So both, I'll just say this for both. Actually, for most STIs, this is actually true. But when you have an active infection, you're actually more susceptible to pick up a second infection because your body's very busy trying to fight the infection you already have. So you're more susceptible to things like HIV, for example, which we will get to. So back to our friendly little gonorrhea. So gonorrhea, symptoms are quite similar to chlamydia. And that's, a discharge. For people with penises, it could be more like a pus-like discharge. Once again, painful urination. Surprise, surprise. People who have vulvas might experience some lower back pain, and they also might experience some vaginal bleeding in between their periods. This could more frequently happen after intercourse, so unusual bleeding after intercourse. For people with penises, pain or swelling in the testicle is also common. Usually just one, though. I don't think both. But the other thing, gonorrhea also infects the anus, throat, and eyes, as well as your joints, actually. Can cause some very painful motion in your joints. If left untreated, gonorrhea will kill someone because it actually gets into the blood and causes a blood infection. So that's pretty important to know. The other thing is that we can treat gonorrhea. Antibiotics do cure most gonorrhea. I hate to say it, but in the past couple of years, we've seen the rise of super gonorrhea, which unfortunately is certain strains of it are highly resistant to antibiotics, which makes it very difficult to cure. There's a couple of reasons that this is theorized to happen. Number one culprit, people are not finishing the antibiotics. They start feeling better. They stop taking them, basically just making gonorrhea stronger. And then the other culprit or suspected culprit that there's been some discussion around is that people having unprotected sex and all the different bacteria in people's mouths has actually strengthened the virus and mutated it. So important to know. Can anybody think of something that I may have missed for gonorrhea that you want to pitch in so far? No? I was thinking I have another gonorrhea plushie, and I was thinking I should make a little red cape for super gonorrhea. Maybe put a little S for super gonorrhea. I don't know. Might be fun. Okay. You're like, why is she talking about these plushies? These are not fun. This is a horrible thing you're telling us. Okay. This one's my favorite. It's my favorite plushie, I should say. My favorite plushie because I just think it's so cute. But this is the plushie for syphilis. Syphilis has 4 stages, and it's very different than other STIs in its symptoms, which is kind of nice because all the other symptoms, they kind of, I don't know if you're noticing a trend, burning when you pee, lower back pain. But syphilis is a little bit different. So, as I mentioned, it has a couple stages, or a few stages, I should say. So the first stage is primary syphilis. And in this stage, a sore appears. It's kind of like a canker sore or like a blister. And some people only get one. Some people get a bunch of them. There's no real hard, fast rule with that. Typically, they're not painful. They're pretty painless. And they usually often tend to go unnoticed. They also might be hidden too, depending on where the syphilis is, because syphilis is, once again, you can get it in genitals, but also in the anus. So a sore might be hidden for someone with a vulva, might be hidden inside the vagina, or the sore might be hidden in the rectum, and you wouldn't know because it's not painful, right? So typically these usually heal in about 3 to 6 weeks. And then the person will enter the second stage, which is secondary syphilis. They're very inventive with their names. And usually in this stage, a rash appears, and it usually starts on somebody's torso or their trunk, and spreads like over their whole body, like even the palms of their hand, the soles of their feet, like everywhere. Um, it's sort of, in most of the pictures, it's kind of like whitish. You can do your own Google search for syphilis pictures. I usually don't show pictures because they always show like the worst ones ever. I actually wouldn't really recommend it. Just go see a doctor. The internet is not your friend sometimes, and picture searches. Mm-mm. Anyway, so the rash isn't itchy, but it sometimes for some people can come with muscle aches or fever, and also hair loss or sore throat, or maybe some swollen lymph nodes. Sorry. So these signs can disappear within a few weeks, but they can also come and go for up to a year. Most people typically, the reason it usually persists is it'll go away within a few weeks, and then people will be like, oh, whatever I had, it just sort of cleared itself up. Okay, I don't need to worry about it. Because the next stage is the third stage, which is the latent syphilis. Sorry. Sometimes I talk too fast. I trip over my words. So in latent syphilis, all visible symptoms just disappear. And typically what's happening is that the virus is actually doing damage internally, quietly inside your body. And this can actually go on for years. And when I say years, I mean like it could go on for like 40, 60 years, like a long time. How long it goes on really depends from person to person, because it depends on things like diet, lifestyle, stress levels, overall general health, other health issues that could, so there's no like set time for one person. It's going to be very, very independent or very linked to their personal health for how long it lasts. So after that, the latency stage passes, you enter the tertiary syphilis stage. And in this stage, this is where the disease does some serious damage to your internal, I want to say organs, but it's not just organs, because it can impact, things like your nerves and your brain and your heart and your blood vessels and your joints and your liver and your bones. And it's, your whole nervous system. It's actually kind of scary. Small side story is I went to London a few years ago, and they had the Hunterian Museum, which is a collection of medical specimens going back to, I believe it was the 1800s, I think. Anyway, they had a whole section of medical specimens of people who had passed away from syphilis, and some of that was truly terrifying, I'm sorry to say. Yeah, like eating away pieces of skull and all sorts of stuff. It's pretty scary. Syphilis is pretty scary. The good news is that it's treatable. So yay, treatable. Antibiotics will take care of it. The main thing you need to know is that with syphilis, whatever damage is done is done. So, if it's done any damage to any of the internal stuff of your body, that damage is done. So, interesting fact about syphilis is we actually thought it was wiped out for a while. We hadn't had diagnosed cases for a really long time. And I regret to say that syphilis is on the rise in many places. In Vancouver, where I live, it's actually been on the rise for the last 5 years. So that's kind of crappy, but it is what it is. So this little guy or girl, or this little virus, genderless virus, is HPV, which stands for human I never pronounce this right, I'm sorry. Human papillomavirus. I probably didn't pronounce that right. If somebody wants to call in and correct me, totally cool, because I never pronounced that right. So we didn't actually know much about HPV until recently. And it's only been, I'd say, I think in the last 10 to 15 years, I think, that we've learned a lot more about it and that we have been able to do more about it. Syphilis is relatively harmless compared to the other STIs. It's a disease we actually don't have a treatment for because in most cases, or in a good portion of cases, our immune system will actually naturally defeat it, which is great because it's pretty contagious. Like, you can get HPV without having sex with someone just by touching them. So it's pretty contagious, but it's not as deadly. It can be deadly though. HPV is the leading cause of things like cervical cancer, which is actually why people with vulvas go for pap tests. As one of the things they check for is unusual cells caused by HPV. So pap tests, yay, very important. We'll talk about that another day. But they're basically looking for, among other things, HPV cells. HPV also is the cause of genital warts. So nobody likes genital warts. That's not fun. Nobody likes warts typically, but genital warts are pretty embarrassing for people, even though they're not particularly menacing, I would say. There is a vaccine for HPV, and I would recommend it. Most people actually, I think in the schools they've started instituting people getting it, usually around age 11, 12. If you have not received the vaccine and you are under 26, I would recommend checking with your doctor about getting it. It is 3 shots spaced 6 months apart, if I'm not mistaken. At least that's how it's administered in BC. And people who are over 26, maybe check in with your doctor. The reason I say that is because you've probably already been exposed to HPV. So it's sort of, I would discuss it with your doctor whether or not the vaccine is a good fit for you. I think that's pretty much it for HPV. Of course, like other STIs, it makes you more susceptible to other STIs, most notably HIV. Does anybody have any thoughts about our friendly little HPV? No way. No comments today. You guys are so quiet. I know, it's everybody's favorite subject. The scare subject. Scary. All right, moving on. All right, so this, I always kind of think that this one looks a little bit like a flower for some reason. I think it's a Muppet thing. Kind of looks like a flower to me. Anyway, so this is the plushie for herpes. Now, herpes, there's 2 types. There's HSV1 and HSV2. So HSV1 is most typically found on the mouth. This is usually referred to as cold sores. Lots of people get cold sores. Interesting factoid is that most people get cold sores by being kissed on the forehead as a baby. So if you're planning on having children, or if you have young children, don't let strangers kiss your kids. It does look a little like a tortellini. You're right. I always think like a flower, but it does kind of look like a tortellini too. I think it's anyway. So yeah, don't let strangers kiss your kids. Also, maybe not family members if the family member is known to have cold sores, because that's typically how so many people end up with cold sores. And it's something like over 50% of the population gets them. It's pretty common. We usually call them cold sores, not oral herpes, mostly because stigma, which we're going to talk about. It is possible, though, that HSV1 can be passed to genitals. It's not as common. However, it is possible if someone has an active cold sore and performs oral sex on someone else, it is possible for that virus to be transferred to the genitals and turn into genital herpes. So that's important to know. HSV2 is usually the most common culprit for genital herpes. So just some things to know. The other thing to know too is that if you suspect that you might have genital herpes, bad news is that they don't really test for it, because the only way to really test for it is through blood testing. But if you have the virus in your system somewhere else in your body, like if you get cold sores, guess what? You're going to test positive. So they can't distinguish. So usually herpes is usually diagnosed by an outbreak. So that's usually an outbreak of symptoms. Symptoms are typically sores or like blisters, and they're quite painful, or they can be quite painful. So that's sort of the biggest thing about herpes. Aside from the fact that at this time we can't actually cure it, we don't have a cure for it because it is fat soluble. For anybody who doesn't know, here's a little nerd tip that I personally love. I don't know why, but I do. So we have this protective coating around our nervous system, around our brain and our spinal cord, called the blood-brain barrier. And it is fat soluble. So things that are fat soluble can cross that protective barrier and sort of hide in our central nervous system, like viruses. And we can't actually pass antibiotics through there, as I understand it. And if somebody is a doctor or a nurse and knows more than me, please call in and tell me, because this is always super interesting to me. But as I understand it, antibiotics are water soluble. So they haven't figured out how to deliver it across the blood-brain barrier without hurting the subject, which is why we can't cure things at this point, like herpes or HIV. But we can treat it. So there are treatments that can actually reduce outbreaks and also help manage symptoms, so things are less painful. The outbreaks, when they happen, are less severe. Outbreaks are typically caused, there's a lot of different things that could trigger an outbreak for someone, and once again, it's kind of a little bit personal, dependent on that person's health. So things like health and stress and diet and exhaustion and friction of tight clothing against the skin, or if they're sick with something else, all those things weaken the body and could cause an outbreak. So if someone has herpes, there is some, aside from medication, there's some other sort of home remedies that can help with outbreaks, either by reducing the pain or helping them heal a little bit quicker, or just making you feel a little bit better. Things like, taking painkillers like ibuprofen, or bathing in lightly salted water can help relieve some of the pain of the symptoms. Same thing with like soaking in a warm sitz bath. Things like applying petroleum jelly to the affected areas, avoid tight clothing, and obviously refrain from any sexual activity, particularly unprotected sexual activity, while there's during an outbreak. Genital herpes is a lot more common than most people know. It's estimated about 1 in 6 people have it. So it's pretty common. There's a lot of stigma around genital herpes. Same thing with any STI, but it's not going to kill you. It's just going to be really irritating and painful. There doesn't need to be any major stigma around it any more than any other medical thing that we deal with. But we're going to talk a little bit more about stigma on a different day. Anybody have any thoughts about herpes that they want to share? Feel free to call in, of course, with your thoughts. Or tell me got it totally wrong and I missed something really important. You can do that too. I don't mind. It's all about education here, right? So this little guy is HIV. And I always love that they put a little ribbon, HIV ribbon, support ribbon. So HIV and AIDS are linked, but they are not the same. So HIV is the virus, and AIDS is when it the virus changes and becomes more active in the body, and it becomes the actual disease. So HIV stands for Human Immunodeficiency Virus, and AIDS stands for Acquired Immunodeficiency Syndrome. Yes. I think out of all of them, probably because of its history, HIV is probably the scariest for most people. It's the hardest to talk about. A lot of that because a lot of people did die when HIV was first discovered. A lot of people passed away, and we can't cure it still. We're close. We are very close. There has been some definite positive movement as far as HIV is concerned. I think there's been 2 demonstrated cases in the world of cured HIV, I think. I honestly don't know enough about the specifics. Once again, if somebody knows about that, feel free to call in and educate me about it. But there have been 2 reports of cured HIV worldwide. So we'll see how that plays out. But we're close. But HIV tends to be quite scary. And the reason it was scary is because a lot of people did pass away. A lot of people didn't know about it in time to take the right precautions, and there wasn't the right education out there. So a lot of people got infected. And there was a lot of experimental drugs, and they weren't always available because of the stigma. And anyway, so it was a significantly humongous deal. I'm happy to say that today, HIV is not the death sentence that it used to be. Before we get into that a little bit, let's talk a little bit about the symptoms. So when someone first contracts HIV, the first signs of infection can be things like swollen glands or flu. And that usually happens, will come and go within the first 2 to 4 weeks. A blood test is the easiest and fastest way to confirm or disprove, I guess, an HIV diagnosis. And as I mentioned, we don't have a cure right now, but there are a lot of medications now that can help someone manage the disease. And there's too many medications, and I'm not a doctor, so I'm not going to go through them all. But there's a lot of medications on the market, and that's good. And so that also means that there's different combinations that people can try in the right balance and stuff. So a lot of managing HIV is getting the right balance of medications for that person. And if they can balance those medications properly, there's this really cool thing that we can do now, which is a person who's HIV positive on the right balance of medication after 6 months can actually achieve a status called or known as undetectable. You guys might have heard this, maybe HIV undetectable. They also call it UVL, or undetectable viral load, which is, I guess, a little bit more of a medical term. So it's probably, most people just know it as undetectable. But basically that means is that the disease is so well managed within somebody's body that when they take a test, the test isn't testing positive because the viral load in their blood system is so low. And that's really exciting because it actually means that someone who is undetectable actually has practically almost a 0 chance of passing on HIV to a partner. They've done quite extensive testing on this. In 2016, there was a study done in Europe and where they were checking for the rate of transmission for people who had undetectable status. And I think it was something ridiculous, like 22,000 acts of unprotected sex and 0 transmission. Yay! There was a second study that was done that actually had 54,000 acts, I believe it was, of unprotected sex and 0 transmission. So that's really exciting. The other exciting thing is that they've actually developed some other drugs. One you guys might have heard of or seen a commercial for on TV, which is PrEP. I don't know if you guys have heard about that. Whenever I hear PrEP too, I always think about like the Let's Talk About Sex song. Let's talk about PrEP, baby. Sorry. Anyway, sorry. It's going to get stuck in my head all the time. And now it's probably in your head too. Sorry. So, PrEP is awesome. PrEP is actually for someone who is not HIV positive. It is for someone who is a partner who is HIV positive, or for someone who's interested in lots of casual and promiscuous sex. So, it's a pill that the HIV negative person takes every day, and this actually reduces their chance of contracting HIV. So that's also really cool. So, like I said, HIV is not the death sentence it used to be. We can do so much more now, and I believe that we're pretty close to curing it, I hope, which would be amazing. So yeah, you guys have any thoughts you want to share about HIV? Maybe something you thought I missed, or you want to comment? No. I'll wait while you guys type. It's okay. You guys are so quiet today. It's because it's everybody's favorite subject. It's actually transmitted infections. Well, that was sort of all I wanted to talk about for sexually transmitted infections today. I don't know if you guys saw the schedule for this week, but we've got some good topics coming up. I don't remember what order we're going to do them in, so I'm just going to look. I think tomorrow we're doing getting tested. Of course, I didn't. I should have had this up, sorry. But yeah, so we're going to be talking about sexual health all week, mostly how it relates to sexually transmitted infections and how the different ways we can protect ourselves. Yes, so tomorrow we're going to talk about condoms and different types of condoms, best practices for condoms, maybe talk about some objections to condoms and how we can handle those. On the 27th, we're going to talk about getting tested, which is a wonderful topic. We're going to talk about, that's sort of where I was planning. We're going to talk a little bit more about the shame and stigma. A lot of people don't get tested because shame and stigma, and they're also embarrassed to tell potential partners or current partners or anyone if they test positive. So I want to talk a little bit about that. 20th, we're going to talk about fluid bonding, which is a pretty cool concept that I'm not going to spoil for you right now. So you'll have to come back on the 28th to listen to fluid bonding or talk about fluid bonding. And then on Friday, of course, we're going to do our questions and answers for anything that you've thought of after this broadcast that you're like, man, I wish I'd asked about that, or oh, I wish I had known about that, or maybe you were inspired to go look something up after this broadcast on sexually transmitted infections, and you found something, you're like, oh, Tila, you were wrong. And I'll be like, great, call in and tell me. So yeah, so we're going to talk about, have our question and answer, and we're also going to talk about living with the disease, because, we got HIV and we got herpes, which we can't cure. So we're going to talk about living with that and addressing certain things that, a lot of questions that people have living with the disease. Okay, so I'm just going to give you guys a little bit more time if anybody wants to call in or comment, so that I'm actually leaving you guys time to do that, not just barreling through everything like I did last week, because I talk really fast. And yeah, if you guys want to chat about anything, awesome. Going back to the Hunterian Museum, if you guys ever go to London, I would totally go see the Hunterian Museum. It was amazing. It was by donation. And if you like medical specimens, and I do because I'm weird, and when I say weird, I mean awesome, it's really actually very cool to see. And there's a lot you can learn there. Not in a boring way, but in a really awesome way. Okay, well, I guess you guys are just really quiet. That's okay. I forgive you. All right, so make sure to tune in tomorrow when we talk about condoms. I'm relying on you guys. I want to hear about your favorite brands of condoms, your favorite lubes to use with those condoms, and yeah, all the other like awesome condom tips. Because I've got a bunch, but you never know what people are always doing, and it always amazes me, and I love to hear what you know, the different experiences people have. So yeah, make sure to tune in tomorrow, either on YouTube or Twitch or Facebook at 8 p.m. Pacific time, 11 p.m. Eastern. I got lots of resources on my website, exploresextalk.com. So there's lots of free articles talking about sexual health, relationships, sex, the whole 9 yards. It's awesome. Check it out. And if you're looking for that little bit extra and you really want to take your relationship to the next level and like dominate your sexuality, then sign up for a Sexy Hero Society, which is a paid membership, $20 a month, and you get access to lots of fantastic and amazing and awesome content. Pretty much every week there's something new for you, and it is pretty epically awesome. So check it out, and we will see you all tomorrow. Have a great night, everybody.